all right? And what you do is you can vary, all right, the doses, okay? So if your concern is your, cardiovascular status isn't going to tolerate being heavily sedated, okay, then what do? You give this, the big dose because you got ICP and you want to make sure they're knocked out, okay, you could give, 2 per kilo or 1.5 per kilo and give your Versed. Does that make sense? Mm-hmm. Because when you have somebody like that, okay, when you're talking about somebody who's septic or horribly volume depleted, all right, or they have crappy, you look at the x-ray and you can tell their ventricular function probably stinks because, they've got a big cardiac silhouette, you've got crappy pulses, okay, so you're not thinking dehydration, you're thinking crappy ventricle, all right, then yes, you are stuck between a rock and a hard place because what is the last reason, did I erase it, okay, to intubate somebody? Impending cardiopulmonary failure, right? You're stuck between a rock and a hard place because if you don't intubate that kid and take the workload off that left ventricle, what's going to happen? Okay? If you give sedation, all right, and why do people do this? And I think most of you have been around long enough to see this. What Nadia's talking about is you're all prepared. You know this kid is heading towards this, all right? And your job is to prevent that. Yet at the same time, because you've seen it, you give drugs to adequately sedate the patient, and their blood pressure goes whoop. All right? Why does that happen? Well, but specifically, why when they're sedated, why do they do that?
Because they've been trying to come to them, not just get out.
But why? It's not because they went, oh, look, she's giving me Versed.
Is it because you waited too long?
Because their tone goes away and the tank is bigger than it was.
Okay, you're removing their sympathetic tone. Okay, the reason the patient's been compensating at that late game is because, their epi and norepinephrine are boom, 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 firing. Okay, when you relax them, and I don't mean paralyze them, I mean sedate them, all right, you're taking away that aspect, and that's why you see them go whoop. So what should you be ready with? If you have a kid okay, all right, when you are in that situation, as one person's drawing up the meds, the other person should be getting a freaking liter, well, they don't know what it is, all right, of normal saline, okay, because you can predict that that's going to happen, okay, does that make sense? But I think for you guys, I would err on the side of using drugs that you are comfortable with, that you feel that you know, if, as you vary the dose, you're going to get, a bit different effects, and you can, use that to your advantage, all right? Because it's just like, the freaking angiocath, okay? If it doesn't work for you, you do better using things that you know than to use another drug that you've used twice and you're not comfortable with it and you're not sure what you're going to get. Does that make sense? Okay. All right. So, don't misinterpret me. There are lots of choices. Okay. And there probably would be a better choice in that situation in the big, giant scheme. Okay. But for you guys, what you need to feel good with the knowledge that you know and are comfortable with, most of the time, instead of, going into left field and using something that you can't predict what effects you're going to get, okay? Because you're going to be hard pressed for it to be wrong to use Versed and fentanyl. Does that make sense? Mm-hmm. Right? I'm not saying there aren't better or other concoctions, but it's pretty nice to have something that's reliable that really does lend itself. Okay. All right. The other things you guys should remember about your paralytics is, go back and look at the paralytics, because there are certain cases, All right? I mean, different paralytics are metabolized differently. Okay? I mean, we use rocuronium and vecuronium, you know, the most, but, you know, you should really know what drugs metabolize in what way. So if you have a kid renal failure, you know what drug to avoid. If you have a kid liver failure, you know what drug to avoid. Okay? All right, and do you hurt someone? I mean, let's say you accidentally give 10 times the dose of a paralytic. What is that going to do to your patient?
Just make the duration longer.
Okay, it just makes the duration longer. You can't paralyze somebody more. Right? I mean, what happens is it hangs around in that synapse, in that junction, for a long time, you know, because it takes, you know, twice as long for your body to break it down. So your patient's going to be prolonged in their paralysis. I'm not saying go out and do it. I'm just saying, you know, if it happens. All right, anything else?